Are you planning to go same-day surgery coder interviews? Are you planning to write CPC exam? Or do you have any difficulty during your live coding of CPT surgery procedures while coding bilateral procedures? Don't worry. So in this session, we are going to know 5 different ways to code CPT bilateral procedures. My name is Harish Gupta, medical coder, process trainer, content creator for FastCoder 21 free medical coding YouTube channel. In my channel, you will get latest updates about CPT, ICPICS and ICD-10 CM. And also you will get latest updates about jobs where I will post jobs for freshers as well as experienced coders. And also I will post periodically related to AAPC's free CU's webinars where you need to attend free CU webinars and you will get free CUs. So in CPT coding, so coding bilateral procedures is little bit confusing. So as per CMS guidelines, bilateral procedure is a procedure where the physician needs to perform the same procedure on paid organs on both sides. So if we see here, CMS defines a bilateral service or procedure as one in which the same procedure is performed on both sides of the body during the same operative session or on the same day. So here key criteria is the physician needs to perform the same procedure on the both sides of the body like paid organs and physician needs to perform both procedures on the same operative session on the same day. Then we can use bilateral procedure modifier which is 50 or RT or LT modifiers based on the pair specific rules. So in order to understand this concept easily, so we are going to take 64483 as the example code. So what is 64483? So injection, anesthetic agent and or steroid, transforaminal, epidural with imaging guidance, lumbar or sacral, single level. So based on method 1, we need to build the same code as two line items using the LT and RT modified separately on two separate codes. In the second method, we need to code one code without any modifier and second code we need to use 6448350 modifier. So in method 3, in single line item, we need to add 64483 and 50 modifier. In the method 4, we will code two line items with 64483 in two separate lines. In method 5, we will code 64483 with 2 units in single line item. So please note, so coding bilateral procedures is completely depend on the payer. So whenever we will code for any type of payer, before coding, we need to understand their guidelines. As we have learned, now we have 5 methods of bilateral procedure coding. So in order to code properly, we need to know the client guidelines before coding bilateral procedures. So in first method, first line item with LT modifier and second line item with RT modifier. So if we take second method, so here first line item without any modifier, second line item with modifier 50. So if we take method 3 here, single line item, we will code 50 modifier. And method 4, we will code single line item with 64483 and second line item with 64483 without any modifier. So if you want to use method 5, you need to use 64483 with 2 units of service. I hope this information is cleared your confusion about coding bilateral procedure. So although if you have any doubt, please mention in the comment section of this video. Now we will learn bilateral payment indicators. So if we have bilateral procedure or bilateral payment indicator 0 means we will not code bilateral modifier to that particular code. For example, if you take 51702 as we are having the only one bladder, we will not code 50 modifier along with 51702 as bladder is a not bilateral body part. So if we have bilateral payment indicator 1, so 1 means we can append 50 modifier here For example, if you take 54530, it is archectomy radical for tumor inguinal approach. As we are having the two testes on left and right side, here we can apply 50 modifier. So you need to check what is the bilateral procedure indicator in order to code 50 modifier. So if you see bilateral payment modifier or indicator 2, so the code description itself is having unilateral or bilateral. So for example, if we take 55300 vasotomy for vasograms, seminal vesicillograms or epidymograms unilateral or bilateral, if the physician performs these procedures bilaterally or unilaterally, we are not going to code any 50 modifier or any type of other informational modifier along with these procedures. So you need to understand here, if the CPT code is having bilateral procedure 2 modifier, we are not going to append any 50 modifier. So if we see bilateral payment indicator 3, so most of the time these indicators are related to radiology procedures. If we see bilateral payment indicator 9, so the concept of applying modifier 50 does not apply to this bilateral payment indicator 9 concept or 9 indicator. If you like this session, please click on like button and also comment and share and subscribe to get more valuable information from my side. Always my intention is to share knowledge, gain knowledge. If you want to know more valuable videos, please click on like button. So thanks for visiting Passcode 21. If you have any problem, contact me at vincentmedicalcore@gmail.com.